I had experienced heat waves before, but it was the first time my body reacted in a certain way whilst I was pregnant. It was a very different response to heat, which I didn't realize before. Around 5 weeks before my due date, I was feeling really poorly. I couldn't sleep very well. I felt really a lot of fatigue, could barely work and focus. And at some point, I was walking around the streets one morning and I fainted. Luckily, there was my uncle who found me by chance and took me to hospitals. And I started to have essentially strong contractions, and preterm was a risk. Luckily, I was in a really well-resourced hospital. They gave me some medications and essentially suggested me to stay in bed for the remainder of my pregnancy. So I took a lot of rest, and my baby was born at term. However, this is not how lucky many pregnant women are around the world. They don't have often access to well-resourced health facilities with well-trained health providers who knows about the impact of heat on pregnancy. Often they don't live in a house like I was, which was well-built, ventilated and with air conditioning. So this is a situation that I was very lucky to have, but often the consequences of heat can be much worse than what I have. And this is something that the High Horizon research highlights. I think it really brought it home. It became much more personal. Hopefully it doesn't affect my research, and I still keep neutral when I look at the data, but it's really about making me understand, even in a high-income setting like Italy, how much heat is able to affect pregnancy. And it's not something usually health workers discuss with pregnant women. It's not something you're aware of. So I was lucky that I was in this line of research and I kind of knew about it. But it's something that we should make more women and more health workers aware of. Unfortunately, the issue about heat and health facilities is often underlooked. This is one of the pathways through which heat can impact maternal and child health, is through the performance of health workers. So heat can impact the ability of health workers to provide that good quality of care that mothers and newborns deserve, especially in low-resource settings where the infrastructure and conditions, the lack of air conditioning doesn't allow them to mitigate that heat. So it's a very important thing for health systems to be aware of and try and assist health workers in mitigating that impact as much as possible. This is something that is going to be more and more prominent everywhere in the world. And even in places where it doesn't seem to be a foreseeable future at the time, it will be perhaps in 10, 20 years. So there are things that can be done, there are low-hanging fruits, like training midwives and obstetricians on the impact of heat in pregnancy, so they can have that discussion with pregnant women. Infrastructure can be changed now, and planning for the future to enable housing and healthcare facilities to keep environmental conditions as ideal as possible for inpatients and health workers.